Welcome everyone to today's video where we'll be showcasing the transformation journeys of multiple patients. So let's begin with the journeys of our first two patients and see how their hair transplant results transformed their appearance, restored their hairline, and boosted their confidence. Some journeys don't begin with noise, they begin with belief. This is the story of our two real patients at different stages of hair loss, one with Norwood grade 3 baldness and the other with diffuse grade 6 baldness. Norwood pattern baldness usually starts with a receding hairline or thinning at the temples, while diffuse pattern baldness causes overall thinning across the scalp without a clear hairline. Knowing your type of hair loss is the first step to choosing the right treatment. If you are ready to transform your look and regain your confidence, QHT Clinic is in Haridwar, Delhi, Gurugram, and Hyderabad. Book your consultation today and take the first step towards your own transformation. Their journeys did not happen overnight. They began with doubt, hope, and patience. Slowly, healing started. Strand by strand, confidence returned, self-belief grew, and the mirror began telling a kinder story. Healing takes time, and patience grows results. Now imagine this is you, searching for a real solution, and then finding this video, a video that answers everything from hairline design to graft placement and PRP sessions. These are not just procedures, because it's a real hair transformation story, and this video could be the beginning of yours. So now let's move to their before condition and step by step learn about their complete journey. This is our patient 1 before condition, where our experts analyze their scalp, checking their baldness grade, donor area quality, and overall hair density in detail. Let's take a closer look at the condition of all these two patients and understand how, despite facing different grades of baldness, one thing remained common: their strong donor area that played a key role in their successful transformations. Patient 1 was facing the challenges of Norwood grade 3 baldness. His hairline had significantly receded, also temples had completely vanished, and his frontal area also showed noticeable thinning, which affected his overall facial appearance. The rest of his scalp, however, was fully filled with hair, and he had a thick, strong, and healthy donor area, which played a crucial role in the success of his procedure. This robust donor region allowed for precise graft extraction and proper placement, enabling him to achieve dense, natural, and truly impressive results. Patient 2 was struggling with diffuse grade 6 baldness. His hairline had completely receded, forming an M-shaped pattern, while the frontal tuft was severely damaged. Thinning was also visible in the mid-scalp and crown, indicating the need for a transplant. In the frontal tuft area, only miniaturized follicles remained, which had significantly affected his facial frame. Fortunately, the rest of his scalp still contained healthy hair follicles, providing a solid foundation for treatment. His donor area was strong and dense, offering healthy grafts that became a crucial part of his successful transformation journey. These were the initial conditions of our two patients, each facing a different grade of baldness, yet sharing one powerful advantage: a strong donor area, which became the foundation of their remarkable transformations. Now let us move forward and see how our experts carefully designed their perfect and natural-looking hairlines. If you are facing similar hair problems, share your scalp pictures with our experts. They will guide you on whether you need a hair transplant or a medication plan. Now let us move to the next and one of the most important steps of our two patients' journey. After a thorough examination of the entire scalp, our experts began by trimming the hair and giving each patient a proper head wash. This helped remove dirt, excess oil, and dead skin cells, creating a clean and smooth surface for precise and accurate markings. While designing the hairline, our experts carefully evaluated each patient's facial proportions, bone structure, and level of baldness. Every marking was done with complete precision, keeping the natural balance and harmony of the face in mind. For patient 1, a customized hairline was designed to restore his natural appearance. The position of the new hairline was carefully measured from the glabella point to ensure perfect facial symmetry. Along with the hairline, the temples were also designed while keeping his facial features in focus. The remaining affected frontal areas that required coverage were clearly marked, and the donor area was marked as well. For patient 2, the hairline was again measured from the glabella point. In his case, the experts marked not only the hairline but also the affected frontal, mid-scalp, and crown areas. The donor area was also precisely marked to ensure optimal graft planning. These markings were not just lines drawn on the scalp, they were the blueprints of transformation. They guided the surgical team, defined the recipient zones, and ensured that every single graft placement contributed to a result that looks natural, balanced, and aesthetically perfect from every angle. After the markings were complete, we moved on to the slit creation process, one of the most crucial steps in a hair transplant. Within the pre-marked zones, our surgeons carefully created tiny slits that determined the exact direction, angle, depth, and density of each graft. For patient 1, an advanced zigzag technique was used while designing the hairline to achieve a soft, natural, and seamless appearance. The temple areas were also treated with extreme precision, with slits created carefully to match the natural hair growth pattern. Each slit was customized according to the patient's facial proportions and baldness pattern, ensuring perfect balance and natural-looking growth. After the slits were completed, our experts began the graft extraction and implantation process, carefully following the direction and angulation created during the slit formation. Now, let's understand the graft procedure for each patient, one by one. For patient 1, single and thin hair follicles were implanted in a natural zigzag pattern to design the hairline. The same type of follicles was implanted in the temple zone, which helped enhance his overall facial frame. In the frontal zone, double and triple hair follicles were implanted to achieve natural volume and density. In total, 3,300 grafts were implanted, all carefully extracted from the safe donor zone. Patient 2 had a more advanced stage of baldness compared to patient 1. To maintain a soft and natural hairline, single and thin follicles were first implanted in the hairline zone. Double and triple follicles were then placed in the frontal and mid-scalp areas to improve density. In the crown region, grafts were implanted in a natural swirl pattern using single, double, and triple follicles at varying angles to match natural hair growth. In this case, a total of 4,000 grafts were implanted. All these follicles are naturally resistant to DHT, which helps ensure long-lasting and natural-looking results. You may have noticed this consistency in our previous videos, and you will see it once again at the end of this video. If you also want your procedure to be done with such precision, then book your slot today. Now let us move toward the patient follow-ups and see how their results have progressed over time. 1 month after the transplant, patient 1 returned to the clinic for his first follow-up PRP session. During this visit, our experts observed nearly 60% shedding across the transplanted area, which is a completely normal and expected phase of the hair restoration process. At the same time, showing healthy recovery with no visible signs of stress or damage. 2 months after the transplant, the shedding phase was still ongoing on the patient's scalp, which is a normal part of the healing process. At the same time, his native hair had already started growing naturally, indicating healthy scalp recovery. The donor area had healed so well that it was completely undetectable, and no one could tell that grafts had been extracted from that region. This remarkable recovery clearly reflected that these results were achieved in just 2 months of growth. Just 6 months after the transplant, patient 1 achieved truly remarkable and life-changing results. When we compare his current appearance with his initial condition, the transformation is clearly visible. His hairline is now well-defined with perfectly framed temples, which beautifully enhance his overall facial appearance. The frontal area has gained impressive volume and density, something he was missing in his initial condition. Overall, his look has changed completely. He is now able to cut and style his hair freely, and the transplanted hair looks completely natural. These early results may vary from patient to patient and largely depend on how well the precautions and dietary guidelines advised by the doctor are followed. At present, we have documented only the patient's 6-month journey, and we will continue to share further progress with you as his journey continues. You can also begin your journey by simply giving us a call or sharing your pictures with us. Our specialists will carefully assess your condition and guide you towards the most suitable treatment option according to your needs. Now let's move on to the follow-ups and results of patient 2. 1-month follow-up of patient 2. 1 month after the hair transplant, approximately 60% shedding was visible on the scalp. This is a completely normal and expected phase of the hair transplant process. At the same time, the patient's native hair had already begun to grow, and the donor area had fully healed, indicating a healthy and successful recovery. 4 months after the transplant, the shedding phase was completely over, and new hair growth had visibly begun, especially in the frontal area. His native hair continued to grow naturally and blended seamlessly with the transplanted hair, resulting in a uniform and well-balanced appearance. The donor area had fully healed, clearly indicating that in the coming months, the patient would begin to experience noticeable, dense, and impressive results. 7 months after the transplant, the patient had achieved complete and mature results, which is scientifically considered the ideal time frame for a full hair transplant transformation. When comparing his before and after conditions, the difference is clearly dramatic and highly noticeable. His hairline is now perfectly framed. The frontal area has gained excellent volume and density. The mid-scalp appears even, and the crown has developed a natural swirl pattern, all of which beautifully enhance his overall facial appearance. The patient can now cut, style, and manage his hair freely, exactly the way he desires, just like natural hair. In the cases of both our patients, patient 1 achieved visible results within 6 months, while patient 2 showed results in 7 months. These early outcomes can vary from patient to patient. They depend on several factors, including the stage of baldness and whether the patient has properly followed the prescriptions and post-procedure care advised by our doctors. Scientifically, hair transplant results vary for every individual, which is why comparing scalp conditions at this stage is not appropriate. Final and complete hair transplant results are typically achieved within 10 to 12 months. If you're also facing similar challenges, then right now, share your scalp picture with our experts, and they'll guide you on what works best for you. FAQs 1. How do I know which type of baldness I have? Hair loss patterns vary from person to person. A detailed scalp analysis by an expert helps identify whether you have Norwood pattern baldness, diffuse pattern baldness, or another type, which is essential for choosing the right treatment plan. 2. How many grafts do I need for a hair transplant? The number of grafts depends on factors such as the grade of baldness, area to be covered, hair density, and donor area strength. Only a proper consultation and scalp examination can determine the exact graft requirement. 3. Is hair transplant result the same for every patient? No. Hair transplant results vary from patient to patient. Factors like age, extent of baldness, scalp condition, donor area quality, and adherence to post-procedure instructions play a major role in final outcomes. 4. When can I expect final results after a hair transplant? Although early results may appear between 6 to 7 months, complete and mature results are scientifically achieved within 10 to 12 months after the procedure. 5. How can I start my hair restoration journey? You can begin by sharing your scalp pictures or booking a consultation with our experts. They will assess your condition and guide you toward the most suitable treatment plan for you. This was the complete transformation of all 2 patients. We hope you found their journeys inspiring, because turning a bald look into a bold look is never easy. It requires expert planning, advanced technology, and most importantly, the patient's trust. If you also want to transform your appearance completely, don't wait. Book your consultation with our experts today and begin your journey towards a new, confident you. You've just seen the transformation journeys of our first two patients. Now let's move on to the next two patients and take a look at their hair transplant journeys, from surgery to final results.
Have you ever caught yourself hiding behind a cap on outings, in photos, or even while meeting friends just because your hair doesn't feel like you anymore? Meet our patients who faced the same challenge for years. Patient 1, dealing with Norwood Grade 2 baldness for nearly 4 years, discovered us on social media. Daily hair fall while combing and the constant need to wear a cap made socializing uncomfortable. Inspired by our YouTube results, he took the step, and in just 7 months, his look and confidence completely transformed. Patient 2, a video creator facing Norwood Grade 3 baldness for over 5 years, felt his receding hairline was making him look older on camera. Caps became a necessity. After seeing our real patient results online, he chose QHT, and within 10 months, his overall look has changed. If you also want to achieve similar results than right now, book a consultation with our experts. In this video, we shared their complete hair transplant journey, from planning and hairline design to progressive hair growth. Watch till the end, and don't forget to subscribe for more real transformations and expert insights. Patient 1, who had an early stage baldness, primarily marked by a receding hairline. Over time, the position of his hairline had shifted backward from the frontal area, causing an imbalance in his overall facial frame and making the forehead appear broader. The recession had also progressed from the temporal sides, which made the frontal region look sparse from the corners. However, the remaining scalp maintained healthy and uniform hair growth, which meant there was no need for any surgical intervention in those areas. Most importantly, the donor area was healthy and dense, an essential factor for achieving natural and successful hair transplant results. In patient 2's case, the hairline had receded significantly toward the mid-scalp, making the forehead appear noticeably wider. The frontal area had become completely sparse, and this mid-stage baldness had a visible impact on his facial proportions. As a result, his overall appearance began to look dull and aged, and styling his hair became increasingly difficult. Being a content creator, appearance played a crucial role in his professional life. The positive aspect was that the remaining scalp still had healthy hair growth, eliminating the need for any surgical intervention beyond the frontal region. The primary requirement was to restore the frontal hairline and density, which was well supported by his healthy and dense donor area. If your hairline is also receding, you can simply share your pictures with us. Our doctors will help you understand your current stage and guide you towards the best treatment option. Once the detailed scalp assessment was completed, our experts moved on to the next step, which is hairline design. A well-planned hairline is the foundation of natural-looking results, as it directly impacts facial balance and overall appearance. To begin this process, both patients' heads were carefully shaved to clearly visualize the extent and pattern of baldness. The scalp was then thoroughly cleansed using a medicated solution to ensure proper hygiene and prepare the area for precise planning. After this, the hairline was designed. For patient 1, the hairline was planned by keeping his facial proportions in mind and accurately measuring the distance from the glabella point. Along with this, the frontal area was carefully outlined, and the temporal angles were precisely marked to restore a well-defined hairline. Since the remaining scalp showed healthy and dense hair growth, no additional markings were required in those areas. For patient 2, the hairline design was approached with equal precision but tailored to his round face shape and facial symmetry. Measurements from the glabella point helped create a soft, natural hairline that complemented his facial structure. Along with this, the affected frontal area was outlined, and the small patchy area with absent follicles was also marked separately. These detailed markings provided the surgeons with a clear roadmap of the bald areas and served as essential guidelines during surgery, ensuring accurate graft placement and optimal density. After finalizing the hairline design, our team immediately began the surgical procedure. First, we then administered local anesthesia to ensure the procedure remained completely painless and comfortable throughout. Once the anesthesia took effect, our experts created micro slits in the affected areas of the scalp. They designed each slit with precision, carefully following the patient's natural hair growth, direction, angle, and depth. This step plays a critical role in achieving natural-looking results. Next, our surgeons performed extraction and implantation, simultaneously using the advanced QHT technique. This method helps preserve follicle vitality, reduce graft out-of-body time, and significantly improve graft survival. For patient 1, our team implanted single and thin hair follicles in the hairline zone to create a soft and natural appearance. To enhance density and provide a fuller look, they strategically implanted double and triple hair follicles in the frontal area. In this case, a total of 2,510 follicles were implanted, all precisely extracted from the patient's safe donor zone without compromising donor density. For patient 2, the team followed a customized approach. They implanted single and thin hair follicles along the hairline to form a smooth, rounded contour that suited his round face shape. To restore balance and volume in the frontal region, they implanted double and triple hair follicles for optimal density. In this case, the surgeons transplanted 3,200 follicles, carefully extracted from the safe donor zone while maintaining long-term donor area integrity. Our team executed every step with precision, expertise, and advanced planning to deliver dense, natural, and long-lasting hair transplant results for both patients. If you want to know more about the procedure, comment hair transplant. After the transplant, both patients visited the clinic multiple times for follow-up sessions. During these visits, our experts closely monitored the healing of the scalp and carefully assessed how the transplanted grafts were responding, ensuring proper recovery and optimal hair growth. At the 1-month follow-up, our experts observed nearly 70% shedding on patient 1's scalp. This shedding indicates that the transplanted follicles have successfully settled into the scalp and entered the resting phase. This stage is essential as it prepares the follicles for stronger and healthier regrowth in the upcoming growth cycle. During this phase, the patient's native hair continued to grow at its natural pace without any disturbance. The donor area showed excellent healing, with the skin fully recovered. Overall, the scalp condition remained healthy, confirming proper graft survival and a smooth post-transplant recovery process. 2 months after the transplant, patient 2 visited the clinic for his first follow-up. During this visit, our experts observed nearly 90% shedding in the transplanted area with mild redness present there, which naturally fades over time as healing progresses. At this stage, the transplanted follicles had successfully entered the resting phase, allowing the roots to strengthen beneath the scalp in preparation for healthy regrowth in the coming months. The patient's native hair follicles continued to grow at their natural pace without any disruption. The donor area has also healed completely without any inflammation. During the first and second month follow-up visits, both patients underwent their first PRP therapy session as part of their post-transplant care plan. This therapy plays a crucial role in stimulating the transplanted and native hair follicles by improving blood circulation to the scalp. Enhanced blood flow helps deliver essential nutrients and growth factors to the follicles, strengthens the roots, and supports faster healing and healthier hair regrowth. If you have any questions regarding the shedding phase or PRP, then drop them in the comments section. Our experts will guide you. 5 months after the transplant, both patient 1 and patient 2 visited the clinic for their next follow-up. During this visit, our experts observed that the shedding phase had fully concluded and the transplanted follicles had successfully transitioned into the active growth phase. At this stage, new hair growth appeared stronger and more mature. The hairline had started taking a well-defined shape, beautifully framing their facial features and restoring overall facial balance. In the frontal area, dense and voluminous hair growth was clearly visible, blending seamlessly with the patient's natural hair and creating a uniform, natural look across the scalp. The overall scalp showed consistent and even hair growth, which significantly enhanced their appearance and confidence. The donor areas had healed completely and became virtually undetectable, with no visible signs of extraction. For both patients, the progress at the 5-month mark appeared remarkably similar, reflecting healthy follicle survival, proper growth direction, and a successful transplant outcome. If you are also ready to bring back your hairline and are looking for the best clinic, then right now, book a consultation with our experts. 7 months after the transplant, patient 1 shared his fully matured hair growth progress. At this stage, the hairline had settled perfectly and now framed his facial features in a natural and balanced way, giving him a noticeably younger and more energetic appearance. The frontal area showed dense and voluminous hair growth, creating a strong and well-defined look that blended seamlessly with his native hair. The overall scalp appeared appeared full and healthy, with uniform hair growth and improved texture. With the restoration complete, patient 1 can now style his hair freely and choose any haircut according to his preference, further enhancing his overall appearance and confidence. 8 months after the transplant, patient 2 confidently went for his first haircut of choice, marking a significant milestone in his hair restoration journey. By this stage, the transplanted hair had grown to sufficient length and strength, allowing him to style his hair freely. The texture and thickness of the hair had improved noticeably, and the overall growth blended naturally with his existing hair, clear proof that the follicles had matured successfully. At the 10-month mark, patient 2 visited the clinic for his scheduled PRP session. This time, he walked in with a completely new hairstyle, reflecting both his restored hairline and renewed confidence. The hairline appeared perfectly defined, soft, and natural, providing excellent facial framing and enhancing his overall appearance. The frontal area showed impressive density and volume, while the rest of the scalp appeared fuller and evenly covered. The hair growth looked healthy, strong, and well settled, with no visible gaps or patchiness. This stage highlighted a balanced combination of natural hair direction, proper density, and long-term graft survival, showcasing a successful transformation for patient 2. Patient 1 initially had early-stage baldness with a receding hairline that disrupted his facial balance and made the forehead appear broader. 7 months after the transplant, his hairline became well-defined and natural. The frontal area gained dense growth, and his overall appearance looked younger, fuller, and more confident. Patient 2 initially had mid-stage baldness with a significantly receded hairline and sparse frontal area, making his forehead appear wider and his look aged. 10 months after the transplant, his hairline became perfectly defined. The frontal area gained strong density, and his overall appearance looked fuller, balanced, and youthful. Both patients achieved highly impressive results despite starting at different stages of baldness. In both cases, the hairlines appeared natural and well-defined. The frontal areas gained excellent density, and the transplanted hair blended seamlessly with the native hair. At the 7 and 10-month marks, both achieved outstanding results that will continue to improve naturally for a lifetime. If you also want the impressive results with painless surgery experience, then right now, book your slot. Give a call or drop a message, our team will reach you out. Or visit any of our branch.
मॉडल कॉलोनी हरिद्वार, D15, आउटर रिंग रोड, प्रशांत विहार, सेक्टर 14, रोहिणी, दिल्ली। नर्सिंग होम प्लॉट संख्या 3, सेक्टर 46, गुरुग्राम, हरियाणा। ऑपोजिट होटल पार्क हयात, रोड नंबर 2, बंजारा हिल्स, हैदराबाद, तेलंगाना।
हेलो फ्रेंड्स, अगर आपने अभी तक हमारे चैनल को सब्सक्राइब नहीं किया है तो प्लीज इस वीडियो को लाइक कीजिए, शेयर कीजिए और हमारे चैनल को सब्सक्राइब कीजिए। और ध्यान रहे बेल आइकन दबाना ना भूलें, जिससे हमारे हर वीडियो का अपडेट आपको समय समय पर मिलता रहेगा।